hernia is protrusion of an intestinal organ from any weak defect in the abdomen. So why does this happen? It is basically because of our lifestyle changes. Nowadays, junk culture has increased a lot. People don't want to eat healthy nowadays. They want to eat all sorts of junk food. So when they eat high fatty food, where is this being stored? It is getting deposited as visceral fat inside the abdomen, which is leading to increased intra-abdominal pressure. The intake of genetically modified food and steroid-loaded food has also gone up. Now, when you take a food that is loaded with steroids, it is causing so many hormone changes inside your body. Estrogen levels in the body are shooting up and they are getting deposited. Estrogen is being stored in the fat. So body is trying to change its course of metabolism, where it is trying to conserve fat to store estrogen, and this is leading to increased deposition of fat inside the abdomen, as well as increased deposition of fat everywhere in the body, including breast also. So what we have to understand is anything that increases intra-abdominal pressure is going to increase your chances of getting hernia. Supposedly a person is a chronic smoker. When he keeps smoking a lot and he keeps coughing a lot, whenever you cough, your intra-abdominal pressure increases. Your intestines will try to come out of a weak defect. Let it be inguinal region, let it be umbilicus, or let it be a weakened midline musculature. Or a person might be having hypothyroidism. He may be chronically constipated, and when he tries to apply a lot of pressure while passing motion, that itself may lead to increased intra-abdominal pressure. Or if a person is trying to do exercise, is trying to lift heavy weights, that then he is also prone to develop hernias due to increased intra-abdominal pressure. In females, whenever they undergo the process of pregnancy, when the uterus is distended, it has its effect on the anti-abdominal musculature also. The muscle is thinned out in case the person is not properly eating. So thinning of musculature usually starts at the umbilicus. So many times patients keep coming back and asking us, is there any medicine that will treat hernia? This is one condition wherein medicine does not have any effect. Hernia has to be repaired through surgery and surgery alone. So how do we repair this? Earlier they were doing herniorrhaphy, wherein the muscles were being sutured together. Then later on they observed that after herniorrhaphy, recurrence rates were increasing. So then a new technique came into use, wherein after herniorrhaphy, that is the muscle repair, we have been placing a mesh over it. We call it hernioplasty. Now results with hernioplasty have been very good, and off late we have started repairing hernias with laparoscopy also. So depending on the patient type, the surgeon chooses which option is correct for them, whether they are suitable candidates for open surgery or a laparoscopic surgery.